Again, good morning, everyone. Today, for our sugar morning on March 5th, we're going to be talking about what to do when you're stuck, getting back on track, and sort of progressing through your weight loss journey. So, as a table of content for today, we're going to be talking about resilience and risk-taking. Dia is going to talk about that in just a second. Things to keep in mind in March. So we're going to recap some things we talked about over the past couple of sugar mornings. Total basal metabolic rate, which Jenny's going to talk about, and then just some helpful applications, which Ricardo is going to talk about a little bit. All right, so I'll pass it to you, Dia.
Yeah, thanks so much, Adam. So hi, I know I'm a new face. It's really nice to meet you all bright and early and start off our day talking about some good stuff. I normally run I'm one of three. I run the motivation, mindfulness, and movement club here at Dr. Curnew's clinic. And what we do, or what I do in particular, is I try to teach motivation science and how you can change your habits and live your healthiest lifestyle just from using your mind and exercising your mindsets a little bit. I typically like this to be a little interactive. So if you're feeling energetic, please feel free to just jump in and unmute. I like my presentations to be really casual and overall a discussion. But something that I always do every Wednesday is that I start us off with a joke because I think laughter is the best medicine. So next slide, Adam, please. This is a really popular one. It's an apple a day really can keep the doctor away, but only if you aim it well. And this is a running joke in our club, and everyone seemed to really like throwing it back at Dr. Curnew and threatening him with bringing apples to the office. So I like to keep this in mind. Okay. So today we're going to be talking about how your mind is a muscle. And a lot of people don't necessarily think about your mind being a muscle. We think about how muscles are worked out using weights. How do you really work out your mind? You go to school, but what happens after that? Does anybody really teach us how to create good habits, how to goal set, and how to stick to those goals? And what happens when you fall off track to those goals? Because that's bound to happen. We're humans, there's obstacles always in the way, and nothing is seamlessly and perfectly on track. So we get stuck for a number of reasons. There's not just one blanket reason for being stuck. In our weight loss journey, in our exercise journey, in our eating journeys, even in careers, getting stuck happens for a lot of things. Some of the most common ones are we're afraid of potential outcomes. The would've, could'ves, and should'ves. Those are real killers of dreams. We're just afraid of anything that might happen. The second one is we worry too much. And I know that a lot of you have a lot on your mind. There's kids, there's careers, there's putting food on the table, there's trying to keep up with family and friends. And now we have a pandemic and throw it all in the mix. There's so much going on to worry about. And that's a reason for getting stuck and not maybe taking risks because you don't have the capacity right now. You feel like you're just spread so thin. And that's definitely valid. The third one is that we like to stay comfortable. So humans are creatures of habits. We like our routines. We like to stick to them. They're predictable. We know exactly what's going to happen next. And there's no room for error. If we have an established routine, if we have our set ways, there's nothing that could go wrong because we've tried it. It's tried and true. We've practiced it over and over, and it seems to be working. And the last one is we don't want to embarrass ourselves. So shame and embarrassment are really powerful emotions, and they keep us from doing a lot of things. And I know in a lot of people's weight loss journeys, it stems from way younger. So it stems from people saying certain things and from maybe trying diets and it not going well. And then you feel embarrassed because everybody knew and they're watching you. There's reasons, and embarrassment is really powerful. But I want to acknowledge that these reasons are okay. We all experience them, but I'm going to teach you a little bit today, just the beginning, how we can maybe grow out of them. I also want to reiterate that growing up is hard. We are taught the safe option always. So as a kid, it didn't really matter. We fell off our bikes. We went on the most treacherous hikes. But as we grow older, we're taught that the safe option is the best option. So we take the trails that are less treacherous. We maybe look at safety more than we look at adventure. And that's something that's programmed in us, and it makes us afraid to take risks. So next slide, Adam. Thank you. Okay, so this is a little bit of an exercise, and I just want you to shout it out or type it in the chat, and volunteers, please feel free to jump in. But on a scale of 1 to 10, I want you to rate to me how risky you think driving a car is.
Is it moderately risky?
Sure, it can be. Okay, so I see 7, 10s, moderately risky. Is that like a 5-ish?
Yeah, something like that.
8, okay.
7.
7, okay. Does anybody have a rationale for why it might be around 7, 8? 4, Terry said 4.
I've been in a few car accidents.
Right. Okay, so past experiences.
Yes.
Yeah. Okay. So some numbers are coming up. So I'm seeing around 4 to 8. There's 1 10 in there. But yeah, not risky on a day-to-day basis, risky in the long term. I think that's a great answer. Okay, keep that in mind. We're going to move to the next one. So the next one is, how risky do you think on a scale of 1 to 10 drinking alcohol is? Okay, 10, 2, okay.
4.
4, 6, okay. 9. Okay, awesome. Thank you for your answers. Keep it in mind. 3 of light, 9 of heavy. Okay, 6. Okay, great, great. And the last one is, how risky do you think giving a speech is? 0.
8.
8, okay. Okay, I see 3 zeros, 1 3, 1 8. We have 1 8. 0 if you're used to it. 1. Rob, keep that point in mind. We're going to talk about that a little bit, getting used to something. Okay. Okay, so I share this with you all because driving a car and drinking alcohol are actually the most risky out of all of them. So driving a car is at 10 and alcohol is at a 10. But the reason we don't think about it as risky is because we all do it. Driving a car is something that we do every single day, and we don't think twice about it. We've practiced it. We did all our G tests. We've been on the highway multiple times. So for us, it's just natural. There's no real risk involved that what we think about when we get into that car. We don't think about what could happen. We just say, okay, we have to go from point A to point B, and I know how to do that. I know how to drive the car. Same with alcohol. We don't think about it because we can't see it, and everybody does it. So it doesn't seem too risky. But when you think about the outcomes, they're pretty bad. Alcohol is a type 1 carcinogen. It's the leading cause of liver disease. There's so many factors that could happen, and the risk is quite high. Versus giving a speech, that's something I think that you caught on. I think you understood. But what was interesting in my Wednesday session is that people rated giving a speech higher in terms of risk because you run the risk of embarrassment. You run the risk of people laughing at you. You run the risk of tripping up in your words and just feeling ashamed of yourself after. But Rob, you hit on a really important point, that giving a speech is not scary if you're used to it. And that's what I want to talk about. So in this slide, we can see that we often confuse new with risky. So something we've never done before, we think that it's risky because it's completely new. But like driving a car, the risk doesn't go down. We just got used to it. It's not something new and it's not something intimidating because we know how to do it. So I want you to start thinking of risks this way. Is it new or is it truly risky? Something that you can do to combat if you're feeling fearful of trying new things is create a fear list. So this is one of my favorite exercises. List out stuff that you're afraid with. So for some people, it's driving. For others, it's maybe going out for a walk in your neighborhood. It's just not something pleasant your neighbors can see sometimes. So it could be something like that. It could be going to the grocery store. It could be trying a new hobby. So anything that you might have just a little bit of fear doing. And I want you to also write down in your list, what will I lose if this risk won't work out? I think you'll be surprised with your answers. Because if you think about it, if you go for a walk to the neighborhood, what are you going to lose? Truly nothing. Maybe you'll risk a neighbor seeing you, but what are they going to see? They're just going to see someone walking. And I really want you to focus on, what will I miss if I don't take this risk? What opportunity are you going to miss out on? So if it's going for a walk, you're going to miss out on the opportunity of having a wonderful start to your morning, of getting your blood rushing and feeling good after and thinking, hey, I did that. I exercised today. So I really, really want you to start thinking this way. What are you going to miss that could be so great and could bring you so much joy? Next slide, please. Thank you. But again, risk taking is hard. And it's not always simple, because if everyone could do it, then we would have already done it. And none of us would be here today. And I myself am really guilty of this, because I don't live a perfect lifestyle by any means. I'm telling you all of this, but this is stuff that I'm still actively trying to practice in my own life. And I recognize that it is really hard. But some ways that can make it easier is taking steps to increase your chance of success. This could mean practicing a speech, just like Rob suggested, practicing your driving, or if you're thinking about excelling in your fitness journey, it could be having a person take you to your fitness class, tagging a buddy along. If you're trying a new diet or you're trying to reduce sugar in your life, it could be having an accountability partner. That's a step that you're taking to increase success, because there's someone there with you to maybe check you and say, maybe today is not the day where we want to do that. We can save it for another day. Or you can check someone else, and having someone watch you can also be really helpful in this journey. Next slide, please. Okay, this is another question I'm going to throw to you all. It's a little tough, but try to answer it however you can. There's also no right or wrong answer. But I want to ask you, why don't we take more risks? Bonnie, good question. Why should we? COVID. Yeah, absolutely. Fear. Good answers. Yeah. I take risks every day. Terry, you should be teaching this instead of me. Next week, I want to hear from you. That's awesome. But I think you bring up good points. Why? Oh, Carmen, you hit the nail on the head. Amazing. We get too comfortable. So you're right. Bonnie, yes. Bonnie, why should we? Because what's the point if everything in life right now seems okay? Seems like we're doing fine. Why take a risk and ruin it? But we don't want to be uncomfortable, because we're creatures of habits. And we don't want to stretch the boundaries. If everything's going okay, we don't want to test our luck and mess anything up. But human beings are afraid of being uncomfortable. But we don't want that to let you stop you. I mean, you took a risk to be here today and to come every Saturday. You didn't have to sign up for this, and you didn't have to let 4 young people try to tell you about how to reduce your sugar. That's a risk. And for you to keep showing up is still a risk every single week that you take. It's a wonderful risk, though, because you can think about, what are the benefits? If it's not suiting you in your life, you can always leave, right? That's the outcome that could happen. That's the worst that could happen. But the best that could happen is that you learn stuff and you start implementing stuff in your life. So just because you took a step and you were a little uncomfortable for a bit, it could bring you so much more in your life. And I want you to think about all the times you maybe did take risks. Maybe you changed your jobs. Maybe you decided to repair a relationship with a family member. Maybe you decided to say, I'm sorry first in an argument. That's a risk that you took, but think about what happened after you took it. So that's the why. Being comfortable with being uncomfortable is a wonderful thing, but it's hard. It's really, really, really hard. So Terry, who is the master of risk taking, I have identified, he hit on something. So I want to talk to you all about how we can practice risk taking. Perfect. So practicing risk taking starts off as small. I don't mean go jump off the bridge and bungee jump tomorrow as a risk. I mean, start with your daily life. Start switching things up in your routine to practice getting out of your comfort zone. And this is a list of things you can do. Incorporate a cold shower a day. Could start with 30 seconds. What's the reason? Well, cold showers, even though you're going to be uncomfortable for those 30 seconds, they have so many benefits. Your skin gets clearer. It's shown to boost your immunity. It's great for your hair. So there's a lot more opportunity in taking a cold shower, even if you're just a little uncomfortable. Something else is wear an item in your closet that you never, ever wear. Maybe a shirt that you got a bad compliment on, or maybe something that's not fitting quite right, but you still like anyways. Wear it. What's the worst that could happen? Paint a new piece of art. That's a risk that not a lot of us take. We left our art a long time ago in elementary and middle school, but take a risk and try something new. Cook a new recipe. This is my favorite one because sometimes we just like to eat the same foods, but try something new. You could try something that was on Dr. Curnew's, I forgot what the club name is called, but there's so many recipes on our YouTube channel. So that's something that you could do, cook something new. You might like it and it might become a staple in your household. You could skip your coffee in the morning. You could replace it with tea. You could take it at a different time. You're taking a risk and who knows, you might like it. You might like the change. This is my favorite one. Actually answer when someone asks you how you are. So something that we do is when someone's like, how are you doing? We just say, oh, I'm doing good. Everything's fine. But what if you really answered that question? What if you allowed yourself to be vulnerable and honest with people? What's the worst that could happen? Maybe you could form a new connection. So I want you to try doing that. That's a hard one, but keep it in mind. And the last one is join one of Dr. Curnew's thousands and thousands of clubs to help change your lifestyle. That's a risk you can always take. So these small risks every day help you to build risk-taking skills. And something that you can keep in mind is that your mind is a muscle. So I'll explain that a little bit in the next slide. Oh, sorry, in another slide. Adam, that's okay. You can go back. We'll go back to the other one. Yeah, there we go. Okay, so this is something else that we talk about a lot in our club. It's the power of changing the way you talk to yourself. So this sounds silly, but the words in your head that allow you to do things are very, very powerful, even if you might not realize it. And sometimes we're not always kind to ourselves. Sometimes we think, you're not capable of that. That won't work out for you because you're just not a lucky person. Or there's no one there to support you. And those are really harmful things to hear yourself say to your own self, because you should be your biggest cheerleader, but it's not always easy. So one of the easiest ways you can get unstuck is by literally talking to yourself. And I know it sounds silly, but I promise it can help. So something that you can do, an exercise that if you're feeling scared to do something, or you might be taking a risk, or if you want to exercise and you're finding yourself overwhelmed and maybe a little anxious with starting because it's a new process, think to yourself and repeat to yourself, either in your head or out loud, I can do it if I want to. I can do it if I want to. I can do it if I want to. Just 3 times. And the reason for this is that resilience comes from self-compassion. So if we're kind to ourselves, we're going to be kind to ourselves even when we fall down. and it's going to be that much easier to get up. Talk to yourself the way you would talk to a friend or a child. If a child falls off their bicycle, you're going to say, that's okay. Dust yourself off, get back up. You're going to figure it out. It's the same for you. If you're feeling stuck in your fitness journey, be compassionate with yourself. You maybe had a bad week. You maybe had a bad couple of months. You maybe had a bad couple of years, but that's okay. Every day's a new day, and you're going to dust yourself off and you're going to keep at it. Next slide, please. Perfect. And the reason that this actually works is that your brain changes itself. So your mind is quite literally like a muscle. With your muscle, every time you put weight on it, your muscle fibers tear, and then they grow back, and they grow back even stronger. And your mind is exactly like that. The reason is because of a process called myelination. This is a fatty tissue that surrounds our nerve cells. You don't have to remember this word, but it grows. Myelin grows just like muscle. The more you practice something, the more that connection in your brain grows, and the more it becomes easier to do something. So when you are consistent with a task, when you're consistent with exercise, when you're consistent with diet, when you're consistent with encouraging yourself, it literally rewires your brain. It takes a little bit of time, but it quite literally changes the way you think. So I want you to think about that. It's very powerful to change up your habits and to keep at it, because everything up in here is a result of what you do on the outside. So some takeaways that I want you to have for today before I pass it off to the rest of the crew is I want you to emphasize in your own life that practicing taking risks is important. It's not only important in diet and exercise, but it's important in all aspects of your life, because everything you do is interconnected. If you practice taking risks in one avenue, it'll help in the next avenue. Something else is, if we have never consistently exercised or eaten healthier, if we'd stayed a certain way over a period of years, it's a really, really, really big step to change your habits all of a sudden. So if you were maybe diagnosed with high blood sugar, and you're like, I have never had this before. I thought everything was going fine. And my diet and eating habits have worked for me before. I feel okay. And you have to change them all of a sudden. It's a shock to your system. And how do you actually do that? It comes with small and slow practice. It will happen if you take steps to rewire and retrain yourself. So some takeaways from today is that you can start to associate pleasure with growth. So staying the same way is now painful. We don't want to stay the same. We want to grow. We want to find enjoyment in things that we can do and things that we might be able to try. Something else you can do is create a fear list. If you find yourself being worried and anxious about starting new tasks, about starting new journeys, cooking new recipes, create a fear list. What's the worst that could happen? What's the best that could happen? The next thing is to practice small risks every single day, because risk taking is a skill that you need to build up. And the last one, and the most important one, is to be kinder to yourself. Everybody gets stuck, and sometimes we get stuck longer than we want to, but there's always a way to fix it. And that's it from me. If you have any questions, I'd be happy to answer them. If not, I can pass it off.
Thank you, Dia. That was really inspiring. I really enjoyed that. I'm just going to give you a small round of applause, and I encourage everybody to do so as well. I think we could all take something from today. I really like the fear list. I think for me, that's something I've personally incorporated in my life. Just sort of thinking about what is it that I'm really afraid of in this activity and what's really holding me back, and just sort of, it's really interesting to sort of dig deep and have that self-talk and being kind with yourself during that self-talk, because anything you say, your subconscious mind is so quick to pick things up. It's really funny. And so just really be careful of that. So Dia, if we wanna see you more, or wanna, hear you talk more, when can we join you? Wednesdays at what time?
Wednesdays at 7 o'clock. We would love to have you. We have a wonderful group. We're all very supportive, and we're just trying to figure it out with each other.
Awesome. Yeah, and we'll include like an email list at the end. So if you guys are interested, just feel free to let me know or just sort of email us, and for sure we could send you guys up.
A wonderful group.
Hello, Dr. Curnew.
Hey, how are you?
There we go. He's on his phone.
Yeah, I'm walking back from the Van Gogh exhibition, so I'll keep listening. I'll have some comment at the end there, but I love what Dia has to say. It all has to say is that take a few risks. I'll be quiet now.
Awesome. Okay, there we go. Pass it on to Nurme here.
Wonderful. Thank you so much. So really, once we figure out all about risk taking, we want to maybe think about what are the next steps that we can do. And before we think about the next steps that we can do, one thing we should kind of look into is what have we already done? And so as we go into March now, and as we go into the next 4 weeks of our 30 pounds in 30 weeks, we want to do a quick recap of what we've already covered in the past. And so here, the first thing that we want to just talk about is that in this video right here, Sugar Morning Diabetes Management Support Group, addressing your frequently asked questions, we focus more on, what is sugar, what are we trying to do in this initiative? What is 30 pounds in 30 weeks? And we talk about things like how you can track your health, how or why weight loss is important to your blood sugar control. We talk about things like different types of diabetes medications, what kind of foods you should eat, how you should measure things like blood sugars, what type of SMART goals you can have. And then the last thing we talk about there is the 30 days in 30 days to a healthier you book. And we'll kind of go over that a bit more in depth, but that is kind of like one of our Holy Bibles for this program. The next month, what we talked about was a drug called Ozempic. And so in this drug, in this session, we kind of talked about, how Ozempic really works. We talked about how we can inject Ozempic, how we can use Ozempic, how we can make Ozempic cheaper for you. We can kind of talked about also, the different types of doses and pens that are available. We also sort of explored the different type of clubs we have at the clinic to help you manage your health. So the goal with this session was to just introduce, different team players that you can have on your team. So, when we make a team to kind of combat diabetes, we want to make sure that we have some star players. And so Ozempic would have been one of these star players. And if that's something that you're interested in, we really recommend that you watch this video called Ozempic for Diabetes Management. And then you can even talk to Dr. Curnew about it at your next visit.
Yeah, just as a thought here, before we move on, this video is a really, really interesting one. As you guys can see, it's been viewed over 381 times. So it's one of those videos I really recommend taking a look at. We talk about Ozempic not just for diabetes, but also for weight loss. There are some people who've spoken about, how it's helped them. And just, I think this video is more to see if this is a right fit. Again, we sort of have this example here of these group members. So Kawhi Leonard helped the Toronto Raptors reach their, the championship and winning. And so that could be your Ozempic on your team. And again, it's a team, it's kind of a team effort. And so you have your Alphonso Davies who plays for Canada soccer team. That could be the videos. Again, that sort of comes together. And I really encourage you to look at that video just to see if this is something that you'd like to explore, something that's the right fit for you. And then we can have a conversation about that.
Exactly. And then here in December there, we talked about specifically our body mass index or BMI and our health. We talked about how it might relate to things like COVID-19, talked about different factors that affect our BMI. And then, we also talked about how we can create an effective action plan to manage our weight. And so we recommend that you really look at these 3 videos just to kind of get a better sense of what we've done in the past few, I guess, weeks, the past few months, and then to get a better sense of what we might be doing moving forward. And the last slide here will kind of show, once again, the 30 Days to a Healthier You book. And that is, what we've been kind of using to, help our individuals such as yourself go through this 30 weeks and 30 pounds in 30 weeks program. And so one thing I would really recommend there is section number 7. So that's the 3 phases of healthy eating. But also, it's important to know that this book has a lot of different recipes that you can try out. And they get progressively different. So, you might see the focus on one week be things like soups. You might see a focus another week be things like beans. And so you can, have something there that kind of works for everyone. And then I want to kind of summarize this entire section by giving you a challenge. And, Dia talked a lot about taking risks and, why we should take risks. Maybe this could be one risk that you take. Very simple. We just want you to try to watch 5 minutes a day of our videos. You might learn something or you might go to sleep. Either way, it'll be pretty effective. We want you to also try to join our Facebook page, and we'll talk a little bit more about that later. And we want you to start today. We always have this question, is it going to happen one day or is it going to be day 1 today? And we want you to decide, but we hope that you can pick day 1. And with that, what I'll do is I'll pass it off to our helpers and volunteers here today. And they'll talk a lot about specifically different types of helpful applications. And they'll also talk about how we can figure out what our basal metabolic rate is. And that will really help us set the stage for figuring out how we can work towards losing weight.
Yeah, so I'll be starting off with the applications. The first one we have is MyFitnessPal. And this one is basically to help you log your diet. So what are you eating? What are you drinking? But it also takes into account your physical activity. And the cool thing about that is you can either log it manually or you can connect it to an app that is supported by MyFitnessPal. So, or fitness trackers, for example, Fitbit, if you have that, you can just connect it to the app and it'll log it in for you. And in terms of how you log in your food and your drink, it has a pretty large databases of a bunch of foods, and I'll show you an example in a minute. But all you have to do is search up whatever food you ate, you select an option that is closest to it, you play around with the servings and the portion, and then you can add that into your log and kind of keep track of that. Another thing that you can do is add your own recipe. So if you're using a recipe and you make that food a lot and you want to kind of make it easier to add it to your log, then you can do that as well. So yeah, we can go on to the screenshots. So this is kind of what it looks like when you're making your account. It's going to ask you a bunch of questions in terms of what are your goals? Do you want to lose weight? Do you want to gain weight? Are you trying to maintain your weight? Also some difficulties you've been having with whatever your goal is, as well as some information about yourself. So male, female, age. It also asks you about your height, your weight. And as you can see on the screenshot on the very right, in terms of losing weight, the maximum is going to be 2 pounds per week. And that's to make sure that you're doing it at a healthy rate. Next slide, please. And after you put in all of your information, it's going to give you like a daily goal of the calories that you want to be taking in. And that's what you're going to be keeping track of through the app. So I'll give you an example of like logging the food using the database. I just search up fried rice. You can see there are a bunch of different options. There's Chinese, shrimp. You can click on whichever one is closest to what you've eaten, and then play around with the servings, the size, the number of servings. And you're going to do that for dinner, lunch, snacks, breakfast. You can see on the screenshot on the very right, it's a really long screenshot. But basically, once you're keeping the log of everything, it's going to be more filled up. As you can see at the very top, it's keeping account of these calories. So how much you've already consumed. Again, exercise taken into account. and then how much you have remaining for that specific day. And I think what's interesting about this app is once you're done logging it for that specific day, it'll basically give you a message indicating if every day was like today, you would have this weight by this specific day. So for example, if every day was like today, you would weigh 135 pounds by January 1st. And I think that's pretty cool because it allows you to see maybe how easy it is or how hard it is to get to that specific day based on what you experienced more recently. So it's easier for you to get an idea of that. And another cool thing is if you do skip through too many calories in a day, it will give you a warning message just saying what you're doing right now is not very sustainable. It's not very safe. Next slide, please. So what I've been talking about so far was for the free version. You can upgrade to the premium version, which is paid. And what it'll give you access to is being able to track your macronutrients. So that's your carbs, your fats, and your proteins. You can see an example of that on the right. It will also allow you to set different goals based on the day of the week, or you can set different calorie goals for a specific meal. And another option is meal plans. So if you're trying to go on a specific diet, for example, vegan or keto, it can give you a plan for that as well. Next slide. So another app that it's kind of similar is called Curnew. So for this one, again, you're able to log your food, your drink, your physical activity, and set target goals for those. But I think one thing that distinguishes it is that you can keep track of both your macronutrients as well as your micronutrients. So your micronutrients, these are like your vitamins and your minerals. And again, you can set goals for those. Remember, MyFitnessPal, it was only macronutrients, and that was only for the premium version. And I just put in an example of what that looks like on the right. So once you log in your food, it's all zeros right now because I just started the app. I haven't put anything in, but it'll keep a record of your total calories as well as some vitamins. These are the micronutrients, and it'll do the same thing for the macronutrients. And if you click on one of them, for example, I clicked on vitamin A, what you can do is set up a daily target, and it also gives you some information about what vitamin A is, and I thought that was pretty cool. Next slide. Yeah, so in terms of setting up your account, it's basically pretty similar, just putting in information about yourself, what your goal is in terms of do you want to gain weight, lose weight, maintain weight, and as you start putting in some food and your drinks and your exercise and whatnot, it'll keep a record for it, and you can see that on the third screenshot. It will be telling you the carbohydrates, proteins, fats, so these are the macronutrients, and if you scroll down a little bit, there will be a similar record for the micronutrients as well. And the screenshot on the far right is just an example of searching a specific food using their database. So I search up raw spinach, and you can see you can put in the specific amount, the serving size, and it'll give you a breakdown of the nutrients that are in that, and you can just add it to your log or your diary. You can see the little locks, your timestamp in the group. I'm going to be talking about that a little bit later. That's for your premium version again, which is the paid version. So next slide, please. So there are some pretty cool features if you do get the gold version or the premium version. One of those is the Oracle function. And basically what that does is if there is a specific nutrient that you want to eat more of, then what you can do is ask the Oracle and it'll tell you, oh, this specific food has a lot of that nutrient. So I think that's pretty cool in terms of if you are deficient in a specific vitamin, for example, and you want to consume more of it, and that can help you with that. There's also a fasting timer, which you can see on the screenshot on the left. And basically, if you're doing intermittent fasting, then it can help you keep track of that. The recipe importer. So for the free version, you can add in your own recipe, kind of like MyFitnessPal, and you can just use that and add it into your diary. But the import recipe function, basically what that means is if you see a recipe on a website and you end up making it, and that's the food you take in for a specific meal, you can just import it instead of manually putting it in. And it also allows you to keep track of more nutrients, so 89 different ones. And you can organize your diary or your log into separate groups or meals. And that includes the timestamps that I showed you earlier, which was locked in the free version. And lastly, there's the diet support. So this is, again, the whole meal plan in terms of, are you going on a vegan diet or a keto diet? And it kind of helps you keep record of that. Next one. So this app here is not to keep record of your food or your exercise. This one is just to remind you of your medications, which I think is also important in terms of staying on track. So for this one, you can either manage your own medications or a family member's medications. It'll give you some daily reminders of when you need to take those medications, some alerts if you've missed a medication, refill alerts. And another really cool thing is it helps you kind of keep a list of your physicians, as well as set up some appointment reminders so you don't forget those either. And another really cool thing is that you're able to share your status report with anyone you want, and you can email it to them. For example, if you want to send a record for your physician in terms of, these are the medications that I've been taking this week, and I've taken them on time, or I've missed a specific medication, you can send them a report by email. And I'll show you a screenshot of that on the next slide. So first, setting up your account, I can ask you a bunch of information. Are you managing your own health? Was this someone else's health? And what exactly do you want to do with the app? And then from there, it's pretty straightforward. You're just putting in whatever medications you're taking. So you put in the name of the medication. It also asks you other questions. For example, how are you taking it? Is it through pills, injections, inhaler? What are you taking it for? How much will you be taking it for? So how long? And how often in a day are you taking it? What time of the day? And then, what are the doses? And from there, I'll set up your reminders. It's pretty straightforward, just putting in the information. And then on the far right is the sending your status report. That's what I was talking about in the previous slide. So all you have to do, as you can see, just put in the email of the person that you want to send the information to, and that'll do it. And for this one, the premium version, there aren't that many big differences, to be honest. I didn't put a slide for it. Really, the main differences between the free and the premium is you're able to keep record of the medication of more than one person. So for example, if you're managing a family member's medications, you can do that for more people. And next slide, please. So this one's the last app that I'll be talking about. It's called Noom. And this one is very psychology based. Basically, it's a pretty comprehensive wellness plan that looks at food, exercise, but it has a lot of mental health aspects that are embedded into it. So the main idea here is to change your behavior so that you're not only losing weight, but you can maintain it for a longer period of time. And similar to the apps mentioned earlier, you can log your food, your drinks, and your physical activity. And it's a pretty similar process in how you do that. And when you're making an account, again, it's going to ask you some personal questions in terms of your weight, age, gender, height. Do you want to lose weight? Do you want to gain weight? Things like that. But it'll also ask you about whether you're at risk of some health issues like diabetes and high blood pressure. And from there, once you make your account, it actually gives you advice on how you're able to prevent or manage those diseases, which I think is pretty interesting. The other apps did not have that. And another pretty unique feature is that you'll be matched with 2 trained coaches that will help guide you and provide support when it's needed to achieve whatever goal you have. So you have a goal coach and you have a group coach. So the goal coach, this person will reach out to you about like twice a week. They check in, they see your progress, they send motivational messages, things like that. And then the group coach, they're going to be managing a group chat basically. So you're going to be put in a group chat with other people that are in a similar condition as you are. They're trying to do similar things using the app, whether that is losing weight or gaining weight or maintaining their weight. And then the group coach is basically going to be organizing that chat, posting some weight loss tips, responding to posts and things like that, just to help keep you on track. And all of these coaches, they are trained in the area, so they do have that knowledge. And again, it gives you articles on nutrition, weight loss, exercise, interactive activities, all of those things to make sure that you're really engaged in the process and you do have the knowledge that's necessary to lose weight or gain weight or maintain your weight in a healthy way. The only thing I would say about Noom is that it is paid. It's not like the other apps I've mentioned where there was a free trial and a free version and a premium version. For Noom, you do get a free trial, but it's like 2 weeks, I think. And then from there, you would have to actually subscribe to keep using the app. Next slide, please. So one last thing about Noom is that it basically, when you're logging your food, because this is more of a weight loss app, but when you're logging your food, it's not going to tell you this is bad food, don't eat it. It categorizes the food into 3 colors, so red, yellow, and green, just based off of the amounts of nutrients and the amount of calories that it has. So for example, red, these are the highest in calories, the lowest in nutrients. You want to make sure that you're not eating those too much. And then the yellow, they have fewer nutrients, more calories, so in moderation, versus the green ones, and these are the healthiest. So they have the most nutrients, and those should make up the majority of your diet. So it gives you some examples on the slides, but the idea here is not necessarily to stop eating specific foods, but to just limit them and making sure that you're eating a balance of the food that maybe are giving you calories that you like to eat, but at the same time, you're getting the nutrients that you need as well.
I guess while we're on that topic here, I'd like to sort of remind folks of what the glycemic index is. And that's also something you guys might want to look at as well. It's in one of our videos. Does anybody know what the glycemic index is? Maybe if you want to put it in the chat. Do you have any idea? Or you could unmute your mic.
It's how your body breaks down blood sugar and releases into the bloodstream.
There we go. And do you know what the good number would be? Like a good number to aim for?
So basically what you think about is the white sugar has a glycemic index of 100, and the lower is better, 40, 50. It really depends on the food that you pick. If you have no sugar in the food, it really doesn't break down to sugar. It just shows the way of digestion. So you can see on your far right are foods that like vegetables and non-starchy vegetables. They don't have much sugar and they have a lot of fiber, so they break down and fill you up. On your left are foods that don't, glycemic index is not relevant because they just have all pure calories. So olive oil is 100% fat, and it's a lot of calories. So what I'm trying to do is avoid the liquid oils, and I'm trying to eat more flax, chia seeds with lots of whole grains, and throwing a lot of beans into my diet as much as I possibly can. And that's been a transformative process to us. We grew up as finish your plate, meat and potatoes, put gravy. That's leading to 70% of people in Canada are overweight. 50% of people born today will develop sugar diabetes. So if you follow what your parents told you, finish your plate, people are starving in China, eat your meat and potatoes, you will be overweight, you will have premature cancer, heart disease, arthritis, depression, atrial fibrillation. It's just unfortunately the wrong diet, and we have to evolve to that. So you can say I can't change, or you can say yes, I can change. And Dia talked about risk. You can actually use different tracking systems over time. Last night was a great video on oxidation, inflammatory effects of food. A week before, we learned that most vitamins are totally useless, and it's real food that's important. And so that's all I have to say about that. The other thing they can mention is that we have our 30 days to a healthier you, and I encourage you to start on page 2. You can track your health, make a bunch of copies, start at 258. Do a health report card. There's a 260 is a blood pressure monitor, 261 is a weight log, 263 is a food diary that you can fill in, and then you can set some SMART goals on 264. On page 267, you can start your 30-day process and write down your progress as you go along there. So different ways to do it. You can use a tracker if you like, which is wonderful. You can use paper if you like to. Anytime you track things, usually things are better. I know it's a pain in the neck to track. You have to decide if you want to just track certain things, not anything. One thing you might want to do is just take pictures of what goes into your mouth before you eat it and say, do I want to eat this or not? And so just pause and reflect a little bit. And that's a different, there's a risk that someone can take. You either share that with somebody or not. I'll be quiet. What's next, Adam?
There we go. Okay, awesome. Yeah, I'll pass it on to Jenny.
Yeah. So when it comes to like setting goals to like lose, gain, or maintain weight, something we want to like think about is like what our body's like. We want to like understand our body, know its capacity and what its limits are. And so this is where BMR and TDEE will come into play. Next slide. Yeah, so first off, what is BMR? So BMR stands for basal metabolic rate. And this is basically the amount of calories that you need to take in one day for your body to basically do the most basic functions. And you're basically like doing nothing. And this is also basically viewed as the number of calories that you can burn in one day, like just doing nothing, such as lying in bed all day. And you might think like, wow, we can burn calories from doing nothing. I thought like we'd burn like 0 calories in a day if we were like laying in bed. Well, no, that's not necessarily true, because inside your body, there's like a bunch of processes going on to keep us like breathing, to help us circulate blood all over our systems. And our body is also producing cells to regenerate the ones that are like dying. And for these processes to happen, energy is required. And for energy to like, and our energy, the energy like that is provided comes from our calories. And this BMR, it's not like a one size fits all. It varies from person to person. And this is based off of weight, age, sex, and height. Next slide. So how to calculate BMR? There are actually two different equations, and that's because of the gender, the gender and like the difference in age and weight, like I said before. So as you can see, the male BMR, some of the values in that equation, it's pretty different from the female BMR. As you can see, like one starts off with like 88.362 plus blah, blah, blah. And the female BMR, you can see it starts off at 447, which is pretty different. And something I wanted to point out here is you can see that the age section, it actually gets subtracted from the BMR. And the reason why it's subtracted and not added is because as you get older, your metabolism actually decreases, which is why that's the way it is. Next slide. Yeah. Oh, yeah. So we're just gonna quickly go through a calculation example and see how we can apply this as in-person scenario. So in this case, Mr. Jones, he's a 70-year-old gentleman, and he currently weighs about 175 pounds, which is 79 kilograms, and he's around 6 feet tall. So that's like 183 centimeters. So if we were to calculate his BMR, basically I provided the equation here. So I just plugged in his weight in kilograms, 79, into one of the brackets, and the other brackets I plugged in his height in centimeters as well as his age. And from the calculation, we can see that on a daily basis, Mr. Jones needs to take in 1,628 calories to just basically keep his body functioning. So he can rest in bed all day and he will just burn off basically 1,628 calories. Next slide.
Wait a second. So I put myself here, 70 years old. That's me. I get a little bit older. And if I just watch this webinar, watch TV all day around, to stay at my personal weight is 1,600 calories a day.
Pretty much.
That's not very much. That's not even a Happy Meal at McDonald's.
Yeah.
I was just about to say, I think most of us eat much more than 1,628 calories. And so I think a lot of us start to put overload, you know?
So it's kind of interesting. If you say that to somebody, is that, and for many people, as you get a little bit older, it could be 1,200 calories a day. That's not very many. So it's, and if you're going to lose a pound a week, that's 500 calories a day. You're going to be eating about 700 calories or less a day. That's physically impossible for the average human being. So
yeah, you made a good point. I'm actually going to bring it up later, how we shouldn't be eating below our BMR. That's why TD is a thing, because we should actually be eating less than our TD, but not less than our BMR.
We could talk about just different stress. So one thing is that and it's interesting, is that the
Yeah, how many calories does the food industry make for every North American? I heard a number around 4,000 or so, 4 or 5,000. In fact, my understanding is the food industry makes twice as many calories than we consume or admit to consuming. I don't see we stockpiling those calories everywhere. I don't see stockpiles of food there just waiting. So I think we realize that we're eating a lot more than we think in calories, number one. And number two, we need a lot less calories. And you mentioned as you get older, your basic metabolic rate goes down. And one of the reasons it goes down is your muscle mass decreases. And so the way to keep your basic metabolic rate higher is to build muscle mass, and that's activity through both resistance, so like things like bands, and if you like to, or some weights, and aerobic activity as well. So keep going, keep informing us, Jenny.
Sure. So what is TD? So TD basically stands for total daily energy expenditure, and it basically estimates how much calories you burn in a day. But unlike BMR, this one also accounts for your physical activity level. So like, are you a very active person? Are you just someone who sits all day or works at a desk job? Or are you someone who's like an athlete training for a marathon, so on and so forth? And similar to BMR, it varies from person to person. And one thing I added extra was just physical activity level. And you'll see how that comes into play in the next slide. So TD, to calculate it, it's actually just the BMR level, the BMR, and you just multiply it by your physical activity level. And as you can see in the purple boxes, each type of activity level has a multiplier value. And you can see that the more active you are, the greater the multiplier. Basically meaning the more active you are, the higher TD is. And for like example, being sedentary, not doing much, just like having a desk job and then going home to sit and watch TV, you would multiply your BMR by 1.2. And let's say you're someone who exercises 6 to 7 days a week. You do cardio or you do resistance, you basically multiply your BMR by 1.725. And I just put like a small reminder at the bottom what the BMR calculation is. And we can move to the next slide.
Before you move this over here, just pick who. I want you everybody to think about where do they put themselves in. I would say I'm a moderately active person. I think I exercise 3 to 5 times a week, and so that means I have to multiply my basic metabolic rate by 1.5. So just sort of think about that's how I can keep my mass burning, keep muscles, and eat more. And I think, people say I use this little cubey thing when I'm watching TV. You're not going to burn very many calories in that area. This morning, I got up and I went, I'll tell you what I did in a few minutes, but I'm up to about 6,000 steps. And I used to average 12,000 steps a day. I just noticed over the last year, I'm down to 8,000 steps. So I lost some fitness when I went back to the gym. The people I play squash with say I look weak, sick, old, and out of shape. And I thought I was doing some things with some walking, doing some stairs, but obviously I didn't do enough. And when I heard that motivated me to change. So I did lose some weight, but I did lose some muscle mass. And one of the things that's I just found out about 2 days ago, if for every pound of muscle mass, let's say you lost 1.5 pounds on Ozempic, and that's a good starting point. Let's say you lost 30 pounds, and that's for most of our goals. And if I just used Ozempic, I wasn't exercising, I just ate less. It turns out you're going to lose 20 pounds of fat and 10 pounds of muscle. So every pound of fat that you lose with Ozempic, you lose 0.5 pound of muscle. And you don't want, and you don't lose any muscle. As we get older, we're losing muscle mass. So you need to think about how to incorporate activity into your life right now. So that's actually kind of really important. I didn't know that until a talk 2 days ago. So I said I learned something new. I just share that with you. So what I'm going to do is boost up my basic metabolic rate. And one of the things is that I also use Fitbit, and Fitbit says most days I spend about 3,000 calories a day. That's just tracking my my walking exercise and the calculations you mentioned there. So different ways of keeping track of that. It's always humbling saying that's not very much. At least it's better than the 1600. And I think Lance Armstrong, by the way, burns 8,000 calories a day. So but he cheats. He uses steroids and different things of that nature as well. But people who are elite athletes, they exercise a lot and they can eat a lot. People like me and you, we exercise somewhat or not enough, and we have to eat less. Take it away, Jenny.
Yeah, actually, to add on, I remember hearing a story about Arnold Schwarzenegger. He actually consumed like 8,000 calories a day at some point. That's like pretty impressive. Okay, so it seems like I actually did not update the slide, but I meant to say that Mr. Jones was a 70-year-old gentleman. So I'm just taking the example from the first one with the BMR calculation. So just ignore the top. It was supposed to be Mr. Jones, a 70-year-old gentleman, and he currently weighs 79 kilograms and is 183 centimeters tall. So in this case, he is an office worker and he's not really physically active in general. What is his TD? And the first step to finding his TD is to find the BMR. And that was something we already calculated in the previous slide here, which I gave out as 1,628 calories. And now we're going to multiply his BMR by his physical activity level. So in this question here, we see that Mr. Jones, he is not physically active in general. So that puts him on the sedentary level for the physical activity level multiplier. So we're going to multiply his BMR, which is 1,628 by 1.2. And this gives us about 1,954 calories. So on a daily basis, Mr. Jones would burn around 1,954 calories. And that's just the, so basically that's the BMR, the amount of calories that Mr. Jones needs, like Mr. Jones burns off just doing absolutely like nothing, plus some.
Mr. Jones is walking to the bathroom, he turns on his flicker, he does his laundry, he goes outside and burps, lets the dog out the back door and watches the dog take a poop and then comes back in. So he's really working hard and he has a QB that he uses every 3 times a week. Just kidding. That is pretty sedentary. So and one of the joys is that getting out there and walking. And one thing you can do if you want to stay out of a nursing home for as long as you can, because the last 2 years of your life you usually spent with bad disability. If you want to prevent Alzheimer's disease, a single thing you can, well, there's a lot of things you can do, but one in particular is still walk. And if you can't walk, wear an aid, get a walker. Keep mobiles for as long as you can. I know it hurts to walk for many people, arthritis, but losing weight helps, using your joints helps. And it's time to, and actually if you exercise, you'll train the muscles and the ligaments and that and strengthen your joints and you'll have less pain. So it's paradoxical that exercise is actually good for arthritis and decreases the amount of pain. We use too many opioids in Canada. There's a thing now right now that cannabis is a safer form of pain medications. The answer is we don't really have a clue what we're doing. We got narcotics and pain medications wrong. And I'm fearful that there's a perception that cannabis is safer. I don't know if that's the case at all. We just don't know. So to me, I'm going to try to be as natural as I can, drinking a little bit of coffee, try to do some, I'm going to try to be as active for as long as I can. And I hope you do too as well. And I'm mad at myself for not being as active as I thought I did. And I'm going to go from 8,000 steps a day. I'm going to try to get back to that 12,000 steps average a day. And for those afterwards, this webinar, I'm going to be going down to the harbor again. I went to the harbor last night. I'm going to go for a skate. So anybody wants to come join us 15 minutes after this webinar, I'm on my way. Come join me. And I'm a bad skater.
I just want to throw a thought here. Sorry, Jenny.
Oh, no. You can go ahead.
I was going to throw, like when Dr. Curnew was talking, I was just searching up how much a 6-inch BMT, Italian BMT from Subway, how many calories that is. And it's 600 calories for just a 6-inch. And I think I've never really went into Subway and really got a 6-inch. It's always a foot long. And so you could kind of double that. And so we're already at, 1,200 calories or so. So just, food for thought. I found it really interesting.
But you could just get one Subway, 12-inch Subway, and that's all you eat for the whole day, and a glass of water. There you go. That's your, and you'll miss all your micronutrients. And so you can see that is, one of the things that happen is that we have to eat smarter as we get older. We don't need as many calories, but we need micronutrients better because we don't absorb these things. So many of us can become iron deficient, folate deficient, protein deficient, calcium deficient, vitamin D deficient. We can do a lot of that with good proper diet. So I urge people to go look at the webinar from 2 weeks ago that we looked at micronutrients and vitamins. If you're going to rely on vitamin supplementation, what 80% of North Americans do, you're wasting your money. You have rich urine and poor health. We don't have the formula of Mother Nature. When we give single nutrients, we supplement them. We don't know that proper formula. Where you get your micronutrients from fruits and vegetables, like for instance, beta carotene in smokers increase lung cancer mortality. Beta carotenoids found in carrots and vegetables has 300 molecules in some cocktail combination that we can't put in a capsule or a pill. So don't rely on supplementation as your major source of getting your good nutrients. So to me is that one thing, if you want to improve your Subway. So you looked at, what was the Subway you looked at? What Subway was that again?
It was the BMT, so bacon.
Lettuce, tomato.
Okay. So unfortunately, that's a common Subway. Now I want you to look at the same time is that if you go for a vegetarian Subway on whole wheat bread and hold the cheese and put sweet onion and add for extra vegetables, how many calories is that in there? Can you try to figure that out there? And Adam, as we go on here, I want to find out.
Yeah, 200 calories.
Sorry?
Without adding cheese, 200 calories.
200 calories. So if I'm a cheese kid, I don't want to throw that. I used to go with my son and I used to put the cheese on his, but I don't want to throw away the cheese now. So I said, how many calories in the cheese now?
With cheese, I'll have to figure that out.
Okay. See that you can actually change and also too, as I get my Subway, I just pack on with instead of lettuce, I put spinach. Spinach has more micronutrients, has more folate, calcium, and I ask extra tomatoes, and tomatoes have leukopiene. It has some anti-cancer properties to it. It's good for the prostate, good for your health. Green peppers and onions and peppers are rich in antioxidants as well. So you can see how you can dress up. Now, it's too bad because Mr. Subway, when I used to go, they used to have oat bread. They don't have that anymore. They have whole wheat bread right now, and which is okay. But I prefer that oat bread. If you're being smart about it, you can actually make it into a salad and get rid of the bread and do better. And be careful of the dressing you use. I just put sweet onions because it's a non-fat dressing. I just put it just a couple drops here and there, very little of that. So that's my recipe at Mr. Subway. Fire away, Jenny.
All right, thank you. Yeah, so last slide, I just wanted to go over why we should know about our BMR and our TD. So like I said before, both values basically provide an idea on how much calories you need to maintain, lose, or gain weight. And this is actually also the type of calculations that are used in those fitness apps, how they like what Regard brought up about MyFitnessPal telling you if you were to eat this amount of calories per day, you'd lose this much weight, or I think the app's you're going too far for yourself, because a good part about understanding our body is also not go over our body's limits. And so this is also basically a starting point to help figure out some new lifestyle adjustments in terms of exercising or changes in diets. And like we discussed before, should we eat below our BMR to lose weight? No, it's not a good idea, because like I said before, BMR is the amount of calories that your body needs to just basically function off of doing nothing. So if you were to eat below your BMR, your body would enter a starvation mode. And because of that, your body will try to lose less calories because they want to maintain as much calories as possible to keep our bodies functioning. And on top of losing less calories for eating less than your BMR, it could also lead to other health issues. You might feel fatigue, and because you're not providing your body enough like nutrition, you might notice like hair loss, or like Dr. Curnew said, potentially iron deficiency, something like that. But something you can do is eat below your TD to lose weight. And some dietitians, they have suggested to maybe eat around 500 to 1,000 calories less of your TD if you want to see like weight loss. And some actually suggest to reduce your caloric intake by 10 to 20% instead, which can be less than the 500 to 1,000. But like what we all know, slow and steady wins the race, and it's better to be slow and consistent rather than starting off big and going inconsistent and then like putting your body at like a bunch of nutrition deficiency issues. So
that's a very traditional approach. I'm not saying that's something we've all tried many times. I think to me is that we have this plan 30 days to healthier you. So certainly try that approach. But I also think, for some people, intermittent fasting could be useful. And if you, and some people feel like, I have one patient who just goes on water for a while, and he's able to lose 45 pounds, but then he goes off of it and gains back again. So I'm the opinion right now is like, I don't know, I used to go fishing when I was younger. And I remember one time being in a school of mackerel, we were catching lots of fish. And if I just went slow and steady, I would have left. But that day things were going well. So if you're losing weight and things are going well with that approach, and keep doing it. And then, what happens is your body will adapt and you'll probably have to change to something. I think we have to try different strategies at different times. So I've tried everything from intermittent fasting. I've tried different supplements. I've tried different things. And I find that there's sometimes you get into that zone. I think athletes do that quite well. You're on a winning streak. So if you're on a winning streak and things are going well, tell everybody to shut up and just keep going. If you're in a slump, then we have to try a different strategy. So I hear what Jenny's saying. That's absolutely true what she's saying. But you know what? I find my biggest problem, I'm a nighttime eater, and I struggle with that. And so if I eat 3-6 meals a day, I don't blah, blah. So to me, what I find sometimes, what I probably get back to is that I might try fasting 1 or 2 days a week, and eat more some other days. And I try to basically not eat too much during the day and eat more at nighttime. But truly, try different things. Don't be afraid to experiment. Learn your body and try different things. If we were all perfect, we wouldn't be here today. And we're all trying to get better. So that's the traditional approach. I'm not saying that's wrong about that, but I'm just saying for, most people who see a dietitian don't lose weight. So I'm happy to try different things. So I appreciate what you're saying. But one of the things I would do is you have to put activity. If you're going to basically be sedentary for the rest of your life, saying I'm too sore, too old, to change, it's too cold outside, I'm afraid of falling and things of that nature, you will need about between 1,200 calories to 1,500 calories as you get older. And then to lose weight, to lose weight, you have to lose 3,500 calories, and that's basically down to under 1,000 calories a day. I cannot do that for the rest of my life or for a long period of time. Maybe you can, but I don't think most human beings can. So figure it out, try different things, but realize that I have to incorporate more activity in some way. I have to have fun doing it. And I'll show you some fun things as well. So thank you so much, Jenny. And you can see how you can change your sub from a 2,000 sub to a 500 calorie sub if you want to. It's not quite the same taste, but it's a healthier choice. Go ahead. Yeah. Taking it. Oh, look at that.
Yeah, I think it's your turn now.
All right. So get that to play. This is what I did today. I went to I went to, I'll just play for a second over here. Does music come in this one at all or not? So
You guys hear the music?
Yeah, put the music. Goes. I was at the Vincent Van Gogh meditation at the convention center. You know, everybody knows Van Gogh is a famous painter and things of that nature. The guy who cut off his ear and was in an asylum, an amazing painter. And my wife said last week, let's go to Van Gogh yoga. So we went last Sunday, and I decided to go back again today because after the yoga class, she looked at me and said, "You're terrible at yoga. And that's okay. I'm terrible at yoga. I can't bend. I can't do the things, but I really enjoyed it." I went back today. She went to Aruba. We're supposed to be on vacation, but with the pandemic, I decided I just don't feel safe to go, and I need to be around here. And if I get sick right now, it would be really bad for all the patients. But this is truly an outstanding an event. I encourage you to go and try something different. So what I did last night, I went skating last night, and then I slept in my office. I didn't get enough sleep. I only had 4 hours and 47 minutes. Woke up at 7, walked down to the convention center, walked back. And so far today, I just had a couple cups of coffee because last night I had all the healthy food. I had all these bean dishes and oatmeal, but I just stuffed my face too many times. So I'm going to try to eat less and try to eat all the healthy foods at nighttime. And and to me, just trying something different. If it doesn't play, okay, go ahead, go play it. Let's play it.
Oh.
It may not play. Don't worry if it doesn't play. So to me, that's just an amazing experience. I went there twice. I remember going to see Van Gogh when I was much in real paintings. These are just projected images. And some of the different quotes he has there, you know, is that success is a series of failures. Van Gogh actually didn't know what he wanted to do in life. He initially decided that he was going to sell paintings of somebody else's. Then he decided he'd be a preacher. Those things didn't work out for him. Then he became a painter. He only became famous after he basically died and things of that nature. I don't think he sold very many paintings during his lifetime. And it's too bad that most of the time the best things that's said to us is at our funerals. And so wouldn't it be nice to make sure we tell people what we really think about them if we, while they're still alive, and share experiences. But this was truly a very nice experience, and I encourage you to try something different. So this is actually yoga. My wife's a yoga teacher, and she cringes every time I try to do yoga. I'm going to go play squash later on this afternoon, and I have to. So the afterwards, I just got a text right now. There's a TED talk I have to go listen to. Then I'm gonna go play squash later on this afternoon. So we're gonna try different things, and let's see what happens. We can just go to the next slide there. And you know, success is going from one failure to the next one, no loss of enthusiasm. And that's Churchill, but Van Gogh. Basically, success is a summation of failures along the way. And it's the totality of this. And this, you know, is part of his famous painting. And look at his images. When I see this over here, this is supposed to be, I think, the Knights of Paris and things of that nature. To me, that's a coronary artery vessel. When I look at that, and atherosclerosis taking place, so you can look at that and just the beauty. And what he did, he took simple things, he made them extraordinary. So, you know, make the ordinary extraordinary, and that's Van Gogh. And you know, he had at times a troubled life, but he left a legacy behind. And so, to me, what I take away from this is trying something new, reach out and try something, and make ordinary things extraordinary, and just enjoy the journey. There's a lot of toughness, a lot of things happening these days that don't make sense. But if we all make the world a little bit better, we're in a better place. It reminds me to say in our book is that 30 Days to Healthier You. It's a book I'm very proud of. Please buy lots of copies, because what's going to do right now is the book costs $30. And right now, all that money we're giving to the Red Cross. And if you do something healthy for 30 days and you let us know, fill out a form, send a form back in, I will send another $30 to the Red Cross. So right now is by the book, Red Cross gets $30. You fill out a form or two from that book after 30 days. I don't care if you lose or gain weight. There's $30 goes to the Red Cross right now because there's a great need in Europe right now. I just can't understand what's happening there, but we'll have to do our part.
Yeah, thank you, Dr. Curnew. So I think we're sort of reaching the end now. So I think we'll sort of finish off with a few other things. So with our Facebook group, I really encourage you guys to join us. So facebook.com/groups/Dr. Curnew Crew. Everything will be posted in the links and the email. And again, this is being recorded. So, I really encourage you to sort of go back and listen to it. Because Dr. Curnew likes to say, and I kind of agree, is that like I only catch 10% of the information that's said sometimes. And so it's helpful to go back and sort of review it and learn and relearn. Again, this is our Facebook group, and I encourage you to sort of look at it. People post updates and what's going on with them. Different clubs at the clinic. So we have the 30 pounds in 30 weeks. So, I thank you for sort of staying here. And we have our sugar mornings. We have follow-ups every couple of weeks with you. The ocean form, if you guys haven't had the chance to fill that out, that'd be a great idea. We have our weight loss crew, which meets on Tuesdays, and Dia was here, and she meets on Wednesdays as well for the mindfulness and meditation. We also have our Sunday dinner group. So there's like 10 to 100 different clubs you could join. Again, it's based on your interest and just taking action, no matter how that looks like, and just taking risks, trying things. If you don't like it, you don't like it, but that's okay.
Did we send everybody an Ocean form today?
We did, yes.
Good. So Ocean is a new software that we're trying to learn how to use. And so what happens is it complete it and send it back. It goes into your chart. So we can keep track of that. And also too, is that if you're interested in anything, let us know. And also too, each of these groups can actually call you and talk to you individually. So Adam and Nurme are in clinic on Mondays and Fridays, and I forget, Nurme, I think you're there on Thursdays. Is that right? I can't remember what day.
Tuesdays.
And so you're there Tuesdays from what time?
10 to 4.
10 to 4. Adam's there on Mondays and Fridays from 7 to about 10, 11 or something like that.
Yep.
And so if you want any of those people to reach out and talk to you, that's great. Dia, I forget what day she's in the clinic, so and she'd be glad to talk to you. But check these things out. Mira and her team call on Tuesday nights between 1 and 5 and on Saturday morning. So even if you want calls on the weekends, we'll find a time to just call and chat a little bit. And have fun. So I'm going to encourage you here's another thing as well, is just take a look at the video. The video last night is anti-inflammatory effects in general, including food. The week before is micronutrient content, because most of us don't get proper nutrition as we get older, and the vitamin store is not going to solve that right now. So interesting bits of information. Tell us more.
So I guess one other thing that I want to sort of finish this off with is that Dr. Curnew mentioned walking and how the importance of it. There's this device called the Curnew mobile device. We have, I think, around 17, 18 now at the clinic. Basically, I think as you can see here, it's a very small device. It's really neat. You just sort of connect it to your phone or tablet, whatever you have at home, and it sort of gives you the heart rhythm. And it's really neat because we sort of measure it before and after walking, throughout the day, as well as blood pressure and your vitals. And it's really it helps and promotes walking and sort of exercising. We also have a KCCQ, which stands for the Kansas City Questionnaire. That's a questionnaire sort of made for heart failure initially, but it's a really, really helpful sort of predictor and sort of gauge for you to see where you're at. And so that's also part of the Curnew mobile. So if you're interested, you could sort of email us and we can get you set up with that one.
Something that keeps track of your. So what you do is that if you're interested, is that you get it for 1 to 2 months. You get this little device you can put on your phone or your tablet. We ask you to measure your heartbeat after exercising 3 times that day, measuring your blood pressure. If you don't have a blood pressure machine, we'll lend you that. If you don't like technology, we have some step counters we can lend with you. And the team will call you along the way. And actually, if everybody can actually fill out the Kansas City questionnaire, this is a scoring system between 0 and 100. So 100, you're perfect. 0, you're dead. It just tells you about prognosis and congestive heart failure, but tells you about prognosis and how you're doing in health in general. So I'll get the team to actually send everybody else a ocean form at some point about
It should be
filling
on the
out.
ocean form.
Yeah, it'll be on the ocean form, just to fill
It
that
is.
out.
Yeah.
And we send a time we can get back to you and can contact you. I like the app we saw about medications. One of the things is that please keep track of your medications. Don't say the pharmacist will call the office when you run out of pills. That makes us behind 2 hours every day because we're filling prescriptions instead of looking after people. I want to fill prescriptions, but I want to fill the prescriptions at your visit when we're talking, so we make sure you're on the right medications, and we'll give you a renewal for a full year if we can. And so really important is that I know medications change, want to work on this, and one way to lower medications is to have more soup, more exercise, have fun, better mental health, better sleep. Fantastic. Anything else you want to tell us there, team?
I think somebody had a question. Great.
Perfect.
You have a question there? Raise your hand.
Any comments or thoughts from anybody? I want to first of all thank you all that you're all here. And I would encourage people to go back, or people who really want to lose 10, 20, or 30 pounds, look at putting diabetes into remission. That is possible for people that are significantly overweight. If you lose 30 pounds and keep it off at 2 years, you can put your diabetes to remission 70% of the time. We are using lots of drugs, and all these young people in front of us that are born today face about a 50% likelihood that they will have sugar diabetes in their lifetime. And every time we look at this, diabetes is doubling and doubling. So we have to, right now, if you don't have diabetes, you're at risk for diabetes by using only 1C, and we have to put a stop to that. And that's going to be the combination of lifestyle changes and maybe medications as well. We mentioned things like Ozempic. I currently use Ozempic once a month, every 2 months at this point in time when I get stuck to lose weight. Many people use it on a regular basis. Some people use it not at all. Kawhi Leonard was a Raptor basketball player for 1 year. He was a superstar. He got people excited about basketball. This gets you excited about doing other things. And if you just use Ozempic without anything else, you're going to lose muscle as well as fat. So you want to lose both. So I'm revving up my engine, as Jenny shows us, on your basic metabolic rate and how to add activity to that. So this combination, all these different pillars, and so I think that's really important. I want to thank the entire team for coming, and all people for staying behind. Any thoughts or final comments from anybody?
No, same thing from Jenny, you want to say something?
Yeah, I just wanted to add in something. Something I forgot to mention was like, as you can see, when we were calculating the BMR and the TD, people might have noticed that there's like so much numbers and like, oh, do I have to like take note to like remember these values? And just want to add in, like, you can actually just Google like BMR calculator or TD calculator on Google, and you can just click any one of the links, and you can actually it'll actually calculate for you. You don't have to use a calculator yourself, and you don't have to memorize those small numbers that I mentioned in the equation. That was just something.
Do we send out a link? We can actually send out an ocean form that we'll have in there. You just have to plug it in, and it will get to that. So I'll get the team to send that to everybody. Is that okay? Adam and Nurme, we'll do that. We'll get that.
We'll do that.
And I like this idea of having different places to store medications. Regad, thank you for showing us that today. And I want to learn more about that. We're developing an app. And I think one of the things is that there's really no central place for medications. And people say it's the same as last time. I told you that last time. I'll tell you that most people get medications wrong. There's been some change. They don't always take their pills the same way it's prescribed. There's the pharmacy can make a mistake. I can make a mistake. Someone else changes something, you can make a mistake. So really be up to date on your medications. Keep an updated medication list on you at all point in time. You can do it through an app if you want to, or on paper. I hope you truly find this book helpful for those that want to look at that. It's a book we're really proud of. And it's a work of many people. And we're really proud of it is that any money collected goes 100% to helping other people, other different programs. Right now, with the war going on, we're going to put the money on that domain. I hope this war is over soon, because one of the wars we have is the war on heart disease, cancer, Alzheimer's disease. We have to fight that war. And then we have to use our other resources to help other battles as well. So let's do it. And let's have some fun doing it. I'm going to thank everybody. When's the next session going to be?
April 2nd.
April 2nd. Okay.
We'll email everybody about that.
Perfect. All right. So April 2nd, we'll probably do that with 9 in the morning. So we delayed a little bit because I was at the Van Gogh yoga class at that time. So I didn't want to delay you too much. And thank you for your patience. And I'm gonna go back and listen to this multiple times. Have a great day, everybody.